Jenny Villeneuve is here from the Murdoch Hometown Pharmacy in Oshkosh, and we're going to talk about something that's really serious. And you've probably heard about it, and maybe you don't know exactly what it is. Good morning, Jenny. Thanks for being here.
Good morning. Thanks for having me.
So we're talking about the opioid crisis, and it's something that I think we've heard about on the news, and it's a word that we hear a lot. So let's explain what the opioid crisis is.
So a 2014 survey of U.S. citizens showed that within the last month, that 450,000 people over the age of 12 had used heroin, and 4.3 million American people admitted to using prescription opioid medication, so pain medication, but for non-medical purposes. That's a huge number.
It is, and sometimes it can happen where you've had surgery and they give you the pain medication, and you get hooked on it, and it can happen easier than you think. So you guys have really stepped in at Hometown. You are a hometown pharmacy, and that's what you guys are all about, being really approachable. You can talk to the pharmacists at the hometown pharmacy. So there's something new that can help in this fight. So let's talk about that.
Okay, so there is a drug that's available called Vititrol that I have begun to administer at my pharmacy. It can be prescribed by any licensed physician, and the patient would have the prescription sent to our pharmacy, and then they come into our pharmacy, and then I would administer the medication to them. The medication works by blocking the opioid response in the brain. So for people who were using opioids for non-medical purposes, it would prevent them from having basically the effects of the opioid medication, and also help to prevent cravings and help them throughout their recovery.
So how does it work? How do the treatments work?
So it's a once-a-month injection that is administered by a licensed either pharmacist, or a nurse can give it if it's given within the doctor's office, but at Hometown the pharmacist would administer. Once a month the patient would come in. They do have to pass a drug screen because they have to be opioid free for at least 7 days. I should also mention it can be used for patients who are fighting with alcohol addiction to help to prevent cravings. So once a month they would come in and receive their injection. It's covered by most insurances. And then we just kind of keep a calendar, and we have those patients coming in every month and they meet with us. We do find that the medication works best if it's used in conjunction with counseling or other psychosocial services within the community.
Life-changing stuff, though. I bet you're seeing some amazing results.
Absolutely. I've had some patients who've come in who have lost family members, have lost friends, have lost jobs, have lost a place to live, and have really made some pretty amazing life changes. I've seen people purchase homes and cars and are back in the community working and being productive members of our community. It's really amazing to see.
So there's help out there. Yes. Ask your doctor about this.
Ask your doctor.
And get in there soon. Hometown pharmacies are doing this. You're also doing some other things to help.
We are working with state officials to provide a disposal pouch for people who find opioids or non-opioid medications within their home and they want to dispose of them and they don't know where to take them. Some communities like Oshkosh, we are fortunate to have a drug drop where patients could bring old medication bottles, but if you live in a community without that, you can stop into a local Hometown and get a drug disposal pouch where you put the medication in the pouch, mix it with water, and throw it in your own trash.
And I think a lot of us need to go through our medicine cabinets, our bathroom drawers. I know for my daughter who got her wisdom teeth pulled this summer out, and she didn't go through that prescription. In fact, didn't use much of it, and you need to get rid of those. You don't want them laying around.
It's best to get it out of the home.
Yeah. Hometown Pharmacy has a lot of locations all over our area. They are really unique. They're, have a lot of unique things. You can talk to these guys, a lot of natural things.
We do.
They're just really different. So if you're thinking about switching pharmacies, you want more information about this new thing.
Yes.
What is it called again?
Vititrol.
Vititrol, or just you've got the sniffles, and you want some advice. Pop on in because that's what you guys are all about.
That would be great. Thanks.
Thank you, Jenny. Appreciate it.
Thanks for having me.
Yeah. Coming up, back to the kitchen to make a brand new beefy slow cooker recipe. Stay with